Greetings and welcome to this edition of the Global Healing Network. I'm your host, Dr. Kamal Kokai, and today we're privileged to have as a guest a senior practitioner in his field of medicine, Dr. Ronald Whitmont, who is a classical homeopath. He's a physician here in the New York State area, New York City, and environs above New York. Dr. Whitmont is past president of the New York Homeopathic Medical Society and current president of the American Institute of Homeopathy. And I feel he has some unique things to actually share and to help broaden, deepen the understanding of homeopathy as it can be practiced. Welcome, Dr. Whitmont.
Good morning. How are you this morning?
Hey, it's morning, so it's a good time of day for me. I hope it is for you.
So it's a nice time, yes.
Right. So, as usual, I always start off with practitioners and ask you, hey, share a case so people can get an idea of your work. And anything you want to share is fine.
Sure. So let me take a couple minutes and tell you about a case that I saw about 2 years ago. And living in the Northeast, it's a common thing for me to see lots of cases of Lyme disease. That's probably the easiest one to describe, and homeopathy can be very effective in the treatment of Lyme. As I mentioned, the approach that I use, I may have not mentioned it yet, but the approach that I use is classical homeopathy, which is different from clinical homeopathy. Clinical homeopathy is the use of medicines that might be homeopathic in derivation, but are applied on the basis of diagnosis, not on the basis of the individual person that you're treating. In classical homeopathy, I use medicines based on the individual characteristics of the person that I'm seeing. And so it's a much more rigorous process. It's much more scientifically based, and the results tend to be much greater. So this is a 15-year-old boy that I saw back in April of 2013 for Lyme disease. And to give you an example of some of the things that I need to know about a client, he had been diagnosed with Lyme about a year before and had had 2 courses of antibiotics covering several months of treatment, and his symptoms did not improve. He continued to have complaints of fatigue, difficulty sleeping at night, difficulty falling asleep. The most severe of his symptoms were bone aches, bone pains, particularly in the knees, the shins, the forearm, the wrists, and all these pains tend to shift around pretty rapidly. He also got random headaches. His spine would hurt. He'd have random chest pains, joint pains, and he actually felt that his condition was getting worse after the 2nd course of antibiotics. So, and that's actually something that I see fairly commonly. That
it is a common presentation for sure.
You get that too. When people get a course of antibiotics, they often have a significant improvement initially, but if it's a case of chronic Lyme, they usually get worse after the antibiotics are treated. And I see that kind of as a stepwise process that after every course of antibiotics, they actually get worse and worse, which is alarming and concerning to me in my practice. And that's one of the reasons I don't use antibiotics in the treatment of Lyme. So that case started, as I said, in April of 2013, and I gave we discussed more of his background history, which is important. We discussed his early childhood, his relationship to his caregivers, and a lot of other details. Psychosocial history are extremely important in utilizing homeopathic medicines correctly. We're frequently looking not only at the physical symptoms, but also at the psychosocial, emotional, emotive symptoms that are part of the case. This particular boy also had a history of asthma for many years, and he was a very compassionate person, creative, very sensitive to people around him, and also had a history of allergies. and some constipation. And that formed essentially the kernel of my understanding of him when I first saw him. And based on the summary of all of his symptoms and looking at what we call the totality of his case, looking at not only the etiology, which is Lyme, and the possibility of co-infections, but also the psychosocial environment in which this boy was living, I chose to give him a single medicine called Ferrum arsenicosum, which is a homeopathic medicine, a single remedy that is used in a variety of conditions. Sometimes we see it useful in cases of people who have allergies, asthma, even anemia. Has a lot of the symptoms that he has in terms of the ability to deal with insomnia, breathing problems, and also these kinds of aches and pains. So again, the symptoms in a homeopathic case are important as an entry point to the treatment, but I'm not treating the symptoms. And a good classical homeopath is not treating the symptoms. He's actually just using the symptoms as a way of understanding what is happening and how a disease is expressing itself in that person.
So, Dr. Whitmont, that was fascinating on a number of levels. For one, I mean, you actually said that you would not use regular antibiotics to treat Lyme disease, which speaks to your confidence in your work as a homeopath. The other piece that's fascinating, just in terms of the totality of symptoms and what that means. And, you know, we're going to get into this a little bit more because the distinction between classical and clinical homeopathy, I think that's important. There are not too many, most people doing clinical homeopathy, including myself, would probably use an antibiotic and then use clinical homeopathy along with that or after that to mop up in different ways. But at the level that you're practicing with homeopathy, I mean, that's really powerful. Could you say more in his particular case, since it is about the totality of symptoms? Ferrum arsenicosum is not a usual remedy that many homeopaths will turn to. What about his case really stood out when it came down to those nuggets of symptoms and, you know, the key to understanding the case and unlocking that with that particular remedy? What stood out?
You know, it's actually it's a homeopathy is a very scientific method of treatment, and we're using the observations of the clinician who is seeing the patient for the first time or maybe in a follow-up. But we're also taking data that has been gathered over 200 years of using homeopathy, studying its effects. And these medicines come from what we call the provings of giving homeopathic medicines to healthy individuals and watching their symptoms. Comes from cases of toxicity where people have been exposed to maybe the crude form of a medicine or a crude form of a drug, and they develop symptoms, and those symptoms are carefully recorded. Those are, you know, like accidental poisonings that lead to toxicities. And they're also gathered from cases that have been cured successfully using those medicines that we, by inference, when we see a medicine work effectively, we can say when it removes those symptoms and removes those conditions, we can then say that those signs and symptoms can be attributed to that medicine. So we have those three sources of gathering information about a particular medicine. In the case of Ferrum arsenicosum, we tend to have a synthesis of the two different elements that make up this medicine. And one is ferrum, which is the iron moiety, and the second one is arsenicum, which is the arsenic moiety. And when you put them together as a salt, you kind of have a combination of both of those. Both ferrum and arsenicum are well-known homeopathic medicines, what you'd call polycrests. And there's a lot of information on those. Sometimes when I choose one of the lesser-known medicines, it might be as a result of finding a case that has a lot of the elements of both or two different other remedies that you'd like to see them combined. And that was the case here with Ferrum arsenicosum. We have very few symptoms about that medicine itself. So at that time I was going on, this was kind of a Ferrum case, and it was kind of an arsenicosum case. With the asthma and the reactive pattern, I didn't mention, he also had a kind of a high level of anxiety and had some ADD going on. And these are all both good signs of arsenicum.
That's excellent. I think people need to be aware that this level of care is given. About how much time as a homeopath to take this information in terms of case taking would you actually have to spend with somebody?
It varies significantly depending upon what you're treating and who you're treating and the complexity of a case. But I would say that most people, most kids, usually about an hour, sometimes 45 minutes, sometimes a little over an hour, are helpful and necessary to get that kind of information. It's sitting down with the patient, it's sitting down with family members, it's sitting down with anyone who can give you some relevant clinical information. With adults, when you want to, they've been on the planet a little bit longer and they have more to tell you. There's usually more background. There's usually a lot more complexity inside their cases. I will generally require about an hour and a half to 2 hours to get an adequate history. And then usually within that time, I'm also doing counseling in terms of lifestyle, diet, nutrition. There's usually other things that are taking place in the homeopathic interview besides just the case.
And this particular client, was his improvement gradual? Did he notice immediate results within a month or two?
He came back to me 1 month later, and it was more of a gradual change. He told me that his Lyme symptoms were now less frequent. By the time he had seen me initially, he was having symptoms every single day. A month later, he was having them only 2 to 3 times a week. The constipation had lessened, but an interesting factor here was that the asthma was worse. And this is part of what we would normally expect to see. If you are dealing with a more recent illness on top of a chronic illness, we usually expect the more recent illness to improve first, which in this case was Lyme disease, and then the older illness, which is asthma, which he'd had since he was a young child. That's either going to remain the same or it might actually worsen before it improves. What we might say a homeopathic aggravator.
Sure. The challenge of doing this is not for the faint of heart. Let's go back to the case because I'm really curious to hear what happened with his Lyme symptoms, and if anything, what really changed in that area, if any changes on blood work as well.
Yeah, sure. So when I mentioned that I originally saw this 15-year-old in April of 2013, the first follow-up was a month later, and that's fairly standard for my office, where he was showing an improvement that was already significant, but not a cure yet. And as I mentioned, the asthma was initially a little bit worse. His sleep had improved, and we basically stayed with the same medicine. I next spoke to him on the phone in July, so 2 months after the second visit, and he told me that he was doing a lot better at that point. He was showing pretty good, what he described as just an ongoing improvement of most of his symptoms. His asthma had now calmed down. His Lyme symptoms continued to improve. He was getting his Lyme symptoms down to about once a week. Following month, I spoke to him on the phone again, and he noticed that he was doing well overall. The asthma was significantly improved, and he was going to start his sophomore year at high school in the fall, and his sleep was better. Basically, he was showing improvement along all sides. I saw him once more in October of 2013, where he had already begun planning for an early graduation from high school. His concentration had improved as well. And this was all under that same medicine. The medicine had not been changed.
And here's the big kicker. How many doses of the medicine did you give him?
He was taking, this was sometimes my cases are only single dose cases. Given his age and given the level of involvement, he was actually taking what we call an LM medicine. So he was taking 1 dose of this medicine every day, which he continued through the next 6 months. But by the time I spoke to him in October, his Lyme had improved. There were no symptoms of Lyme left, and that had been for the last 2 or 3 months, no more Lyme symptoms. And he was also doing better from the point of view of his anxiety and depression. Not depression, from the anxiety and the asthma. In terms of documenting what was improving and what was not, this is a tough thing in any stage of Lyme disease, and tends to be a real Pandora's box when you start doing the tests.
Right.
For that reason, I don't base my treatment on whether the test is positive. I base my treatment on how the person is feeling overall. If they're getting less symptoms of Lyme disease, and we can document that, and we can get some kind of objective measure. In this case, his relatives were also telling me, yes, he's sleeping better. Yes, his concentration at school is better. Yes, he doesn't complain anymore of symptoms. So we had them from the patient, and we had them from the family members that are living with him, and everyone was saying the same thing consistently. When you check for the Lyme titers and you check for the Western blot, these are tests that are going to remain positive for years, whether you're treating with an antibiotic or whether you're treating with something else. So they're not reliable indicators of whether you're actually getting to the basis of treatment. And in fact, you can make the argument that when you see the Lyme titers going down, it may not be a good thing, because these are antibodies. And that, the Lyme titers are an indication that the immune system is strongly active and strongly fighting Lyme. So why would you want to see those tests go down?
Right. Well, thank you for sharing that, because that really helps to clarify what homeopathy is capable of doing. It's really painstaking work. When I have taken a case and using a classical homeopathic model, you have to invest a lot of time and energy in really studying and dissecting it. And the thing with classical homeopathy, when I say you have to be strong of heart, a lot of times doctors get into the habit, you take a diagnosis and I know I can do this, this, and this. When in homeopathy, each case is unique, because you're really not treating a diagnosis, you're treating a person and everything that goes along with that. So I really say kudos and all the respect, for being able to do that.
Just a footnote in what you say, because you're actually absolutely correct. That's one of the reasons it is so important to have a medical background when you're using homeopathy, because we are treating people with diagnoses, even though we may not be using the homeopathic medicine to directly, on the basis of the diagnosis, which we're not. We're using the homeopathic medicine on the basis of the total synthesis of the symptoms. But it's important to have an understanding of what could go wrong and what could happen in any given case. And that's why it's so important to understand what's happening medically as well as homeopathically.
So maybe we can step back a minute and talk about your introduction to this field.
Sure.
You've chosen to take this on, right? And anybody that's stepping outside of allopathic medicine, it takes a bit.
Well, yeah, it is a different paradigm of understanding how the body works. In the allopathic framework, there's very little recognition or understanding that the body has an intrinsic ability to heal itself. Whereas in a homeopathic framework, we're actually relying on the body's ability to heal itself. So homeopathy wouldn't work if the body couldn't heal itself. Now, when I say itself, I mean it does take some help. It does take a little bit of push here and there to get it on the right course. But we're essentially relying on the immune system. We're relying on the cardiovascular system. We're relying on what previous generations of homeopaths have called the vital force, which has yet to be defined exactly what that is, and perhaps that's just homeostasis. Yeah, it's a different framework.
I don't think people understand that we're talking about classical homeopathy being able to really heal rheumatoid arthritis, lupus, any number of the type of diseases that really plague people at this point. And I think it's important for folks to recognize that this is another model to turn to, when you have a serious illness.
I would agree with you there, and say with a footnote or a caveat that those conditions that you're mentioning are not going to be effectively treated by a kind of a superficial approach to homeopathy. That really involves a fairly in-depth understanding of homeopathy and the ability to really see and predict what's going to be happening with the body once you give a homeopathic medicine. You have to be careful, you have to be patient, and it's as you said, it's not for the light of heart.
Right. Right now we have something I call health food store homeopathy. There's all levels of education, and exposure to homeopathy. Where would you point people who are seriously interested in the study of this, as a scientific discipline, as a medical discipline, that's really going to reach deeply into the economy of people to bring about real healing?
Well, I guess it depends upon who you're talking to. If you want to mention to the consumers about homeopathy and patients, how do you learn more? It would be to look at various organizations. For instance, the American Institute of Homeopathy is an organization that's been around actually longer than the American Medical Association has been around. It is the oldest continuously operated medical society for professionals in this country. This is again for licensed healthcare providers of many different specialties who can learn about homeopathy, who can interact with their peers, who can gain educational sources through this organization. If you are not licensed and if you still want information, the internet can be a reasonable source, but you have to be careful there. There are other organizations like the National Center for Homeopathy and the North American Society for Homeopathy, or NASH. And these are organizations that are involved in helping what we call lay homeopaths, or just the general public, learn more about homeopathy in a more accurate sense of the word.
And what would you say, looking at the future of medicine, periodically we see, quote unquote challenges from the FDA or different, articles that are printed, in the world literature, sometimes castigating homeopathy. At the same time, you have the popularity of homeopathy in places like Europe, South America, and India. What do you see as a future for homeopathy, both here and abroad?
Well, that's a great question, and I think pretty much abroad and in Europe and in most of Asia, homeopathy is well established. In India, there are over 100 four-year medical colleges that specialize in homeopathy.
Wow.
Has been recognized by the Indian government. It is subsidized by the Indian government. In a lot of European countries, homeopathy is part of the National Health Service. It's been part of the National Health Service in the United Kingdom for generations. The royal family in England uses homeopathy. They have their own homeopathic physician that treats them. So most of Europe it's been well established. If you walk down any street In Paris, you'll see homeopathy being offered in pharmacies. It's rare not to see it there. It's estimated that between half and three-quarters of physicians in Europe routinely either use homeopathy or refer to homeopaths. In the United States, things are different. We're talking less than 3% of the population in the United States uses homeopathy. There are a lot of right now. When you mention the FDA, their FDA is doing an ongoing inquiry into homeopathy. Incidentally, the FDA has regulated homeopathic medicines since 1938. The homeopathic medicines are part of the Medicare Act of 1963. Homeopathic medicines are illegal in this country, but they're just underutilized. And what you're seeing in the press coming out of Australia recently is an organized attack on homeopathy, which is not new. These attacks have taken place since the 1800s, and in fact, the American Medical Association, a very powerful lobbying force, was founded on principles of fighting homeopathic medicine. In their first charter, they forbade their members from even associating with homeopaths in this country. So it was a turf war. It was an ideological war, and it wasn't based on science.
And you see that, and then you see the Swiss government comes out promoting homeopathy for its population. So, folks, I neglected to update you. This is Dr. Ronald Whitmont, who's a classical homeopath, both in New York and the upstate area, and he's been sharing his wisdom as a senior practitioner in this field. Dr. Whitmont, how can people reach you? I think anybody with Lyme's disease or suffers with a serious chronic illness could really benefit from classical homeopathy, and I'd like them to have the opportunity to contact you if they choose to.
Probably the best way to reach me would be just to go to my website. If you search my name online, you'll come up with my website. The address is www.homeopathicmd, so homeopathic medical doctor, or md.com. That's my website.
All right. Dr. Whitmont, this has been a pleasure. Any parting words before we sign off here?
Well, thanks for the opportunity to speak. I look forward to talking to you again, Kamau.
Right. It's been a pleasure just seeing you at conferences and knowing the work that you're doing. All right, man. Take care.
All right. You too. Bye-bye.
Bye.